Hypothermia is a constant concern surrounding anesthesia and surgery in both human and animal fields. In the world of high-quality, high-volume spay-neuter, close monitoring and constant preventive and therapeutic measures must be employed. The unwanted side effects of this common complication include increased surgical wound infections, prolonged recovery from anesthetic drugs, impaired coagulation, decreased cardiac output, and significant patient discomfort, which has often been reported by human patients to be worse than their surgical pain. In essence, hypothermia can cause our patients to not clot as well during surgery, wake up more slowly, have increased discomfort post-surgery, and be more likely to get a surgical site infection. The main reason hypothermia occurs in patients is due to the administration of anesthetic drugs. Almost all anesthetics impair the body's normal thermoregulatory control, its internal thermostat, so to speak. The drugs cause vasodilation, which means that the body's warm core heat is redistributed to the extremities and peripheral tissues by the increased peripheral blood circulation. This heat is then lost mostly through the skin. Other factors contributing to hypothermia include being a pediatric or small patient, the loss of large amounts of hair through the surgical clip, the use of cold or evaporative scrubs and solutions for surgical prep, an open abdomen during surgery, low kennel, prep, and operating room temperatures, and most importantly, lack of preventive and warming measures on our part. A thermometer or temperature probe should be used to monitor all anesthetized patients. We take patient temperatures every 10 to 15 minutes after surgery until normal and/or the patient is sternal and moving. We check at the same intervals during surgery if it is an extended procedure. Again, the best management for hypothermia is prevention. Since most of the body's metabolic heat loss is through the skin surface, this is where our focus should be. Here are some things we can do. Always line metal cages or tables with newspapers, towels, or blankets. This helps to insulate against the cold stainless steel surface. Cover patients with blankets in their cage even prior to surgery. This keeps them warmer and can also be comforting. The blanket may stay with the patient throughout the day unless it becomes soiled and requires changing. Provide heat sources, such as a warmed rice bag covered with a plastic sleeve for those who need it. For example, pediatrics and small patients. Remember to use caution to prevent thermal burns. Once used, the sleeve can then be discarded and the rice bag reused with a new plastic sleeve. Cover the patient's extremities with baby socks to prevent heat loss during and after surgery. Some studies indicate that this method is more effective than warming the trunk. Use warmed scrub and solutions, avoiding alcohol due to its evaporative cooling effects. Clip community cats with a smaller field so that they may retain as much hair as possible during colder months. During surgery and recovery, we use active heating devices such as warm water circulating blankets, heating pads or blankets, and warm rice bags. Use caution when using rice bags. Always place a blanket between the bag and the patient, and never place them underneath, only next to the patient. Other devices such as forced warm air blankets, hot water bottles, and resistive electrical blankets may also be used, and your veterinarian will be able to help determine the best method for your clinic. We prepare our recovery mat with several different layers. First, a rubber mat is placed on the floor. Then on top of that, an emergency blanket to keep the heat towards the patient. Next, we add an electric blanket contained within a twin plastic mattress cover and turn it on high. And lastly, a large comforter is placed on top, totally covering all areas of the heating blanket. When bringing a patient down to the recovery mat, make sure the blanket is large enough to completely wrap the patient. When bundling a patient, we wrap them burrito style. Warm any fluids intended for subcutaneous or intravenous use, or for intra-abdominal lavage. Additional measures that can be taken for moderately to severely hypothermic patients include wrapping them in emergency blankets, lining the body with additional heat sources, administering warm subcutaneous fluids, and wrapping the head or ears.